entry and exit procedures in parental facility during COVID-19 pandemic. Before we start the session, I have an announcement to make. Our heart goes to the family of Vikram Shukla, who has lost his mother today morning, and he will not be joining today's discussion. We express our deep condolences to the grieving family, and we'll start the program without Vikram. He'll not be joining us. My name is Vishal Sharma, and I volunteer with PDA India chapter in bringing you these webinars along with my colleague Binny Joseph. By taking up today's discussion, before we take up today's discussion, a brief introduction about PDA India and PDA India chapter. PDA is in existence from 1946, and PDA India chapter is connecting people, science, and regulations since 2013. Current board, which is for 2020 to 2022, is the fourth board in succession. And if you see Mr. Shirish Bilapure, he is the current president of the board. Vikram Shukla, he is the secretary for the board. Dr. Rustam Modi, he is current treasurer. Ivy Lewis, she is immediate past president. Ravi Menon and Ranjit Menon are volunteering with the board. And you know me, Vishal, I am the president-elect for the board. So welcome to all of you. And now we start the session. When we brought this session to you, India chapter has become extremely sensitive to the fact that you have access to many sources of information and best practices on how to work during this pandemic. So we would not want to repeat the information which you already have access to, but this webinar will explore the impact of COVID-19 on unit operations and the small things which have changed in our entry and exit procedures. By the way, these small changes make a lot of difference to avoid the contagion. I'm joined with my two comrades, Ravi Menon, who manages the manufacturing operations of world's largest vaccine manufacturer, Serum Institute, and he is an active volunteer to the chapter. Along with Ravi, I have Ranjit Menon, who has been associated with... Good morning, Ravi. Ranjit Menon has been associated with India chapter from its inception and has volunteered for various roles. Last being treasurer for the previous board, he manages the manufacturing site for a joint venture between Zydus and Pfizer in the oncology spaces. Welcome, Ranjit.
Thanks, Vishal.
Okay. This webinar is for 1 hour and 30 minutes. We will encourage you to type your questions. You will find a questions box on your screen for the facilitators, and we'll take them at the end of the webinar. Ravi, my first question is to you when we begin with this session. What is the scope of today's discussion, and what has changed in parental manufacturing procedures due to this pandemic?
Yeah, thank you, Vishal. Great to be with all of you who are listening in, and it's a topic which is very close to all of our hearts. Not only our hearts, but our families' hearts. Everyone is really worried about what's going on, and it's I don't think in the last 70 years any such event has taken place since the last flu pandemic in 1918. So we are not going to, tell you stuff which you already know, which is how to enter, how to exit, all this stuff. We are only going to give you a orientation that, yes, you need to now stretch the boundaries of care all the way to your house. And, the journey between the home and the factory is critical. The entry into the factory, not entry into facility, is now become critical because like all pharma approaches, our intention is to stretch the battery limits of cleanliness as far as we can take them. Yeah, and the slide you see in front of you explains the structure of the presentation and how we will be tackling what you need to do at home, what you need to do at transportation, what happens at the security gate, how your primary change and other things are going to be affected, how the secondary changes are going to be affected, and more interestingly, how careful we have to be while we exit, and then how we make our way back home. Vishal, next slide, please. Okay, so what has really changed in our life? We have been hearing over and over again that among all the objects in the aseptic processing area, the human being is the most dangerous object. You can sterilize and decontaminate most objects you pass into the clean room, but you cannot sterilize or decontaminate a human being. At best, you can wrap him in clothing which is multi-layered, and hope that he is doing his wrapping carefully, and hope that he has reached inside and he will behave in the clean room in a manner in which he won't contaminate the product. But now and of course, added to that, when you had toxicology products, there was a situation where not contaminating the operator was also critical. Okay. But that not contaminating the operator was restricted to the work area, and he had to be careful only in the work area. Now the story is completely different, that you also have to worry about things contaminating you outside the work area, and that's COVID-19. It's like you are, when you travel from out of your home, which we assume is a, clean space, and travel into the factory, which we assume is a clean space. It's almost like you are traveling through a BSL-3, and I don't want to exaggerate it, but maybe not as bad as a BSL-3, but the sense is you have to behave like you are in a BSL-3, and you have to try to be careful where you touch, be careful that if you have to touch, then decontaminate your hands and things like that. So this new normal is where you have to be aware of potential contamination to you anywhere during your transit out of your safe zones. Over to you, Vishal.
Thank you, Ravi. Ranjit, you have seen Ahmedabad suddenly becoming epicenter of pandemic in Gujarat, and you have a site there. So, what has changed for your site? Do you want to add on what Ravi has just mentioned?
Yeah, Vishal, you're absolutely right. And, Ahmedabad and of course, Gujarat overall as a state, and then of course, Ahmedabad has a more number of cases. So the overall situation has changed drastically. And the most important thing that has come into, and we all are aware that the how we can prevent the virus is by maintaining some personal hygiene as well as other things. So what has changed drastically as far as the pharma industry or the site is concerned is that we have now uh, implemented few more additional points, mainly into the personal hygiene, which was never, because in the past we all are aware that we always have thought of protecting the product. Rather now it has, the situation has changed. Now we are protecting the product as well as a person, myself as well as a person along with me. Then at the same time, the materials that we carry, we bring from home, we take it into the clean area. Are we, so there has been restrictions in that. There has been changes in the procedures and processes. It's, as I said earlier, that it's not only the product, but for the personal production also. Above that, the main part is that the cleaning and sanitization. We always have been hearing that we need to be, we have to follow the procedures. We have to increase our sanitization process. We have to ensure that the viruses or the contaminants is not there. So overall, there has been a big change in terms of personal hygiene as well as procedures that we will be seeing in the future slides. Okay, Vishal. So, as I said earlier, that we have been hearing on this COVID-19 for a very long time now. It's almost more than 2 to 3 months. But the million-dollar question, what has been coming in the mind, and I'm sure that everyone will be also thinking, is that are we aware of anything and everything of this virus, that is coronavirus? The big answer is no. But we do know that it spreads through respiratory droplets produced when an infected person coughs or sneezes, and a healthy person, being maybe infected when they touch a surface that has virus particles on it, and then touch their own mouth, nose, or eyes. So, and apart from that, one good, the data is that there are studies which reveals that an average person touches their face almost 23 times an hour, and about half of the time they are touching their mouth, eyes, and nose, the mucosal surfaces that COVID-19 infects. So it's not only the hands that are the source of infection, but there are other factors also that needs to be controlled or ensure that it has to be, we need to maintain. So the overall personal hygiene has taken an important role here, and it has this slide, which is in front of everyone, and I'm sure that majority of the people or the team who is here in this discussion, maybe from injectables, and every injectable plant has an entry and exit procedure, and majority of all the things that has been given here is a part of the procedures. There will be sentences in the procedures that says that the nails has to be cut short, that it has to be clean shaved, fresh and washed dress has to be worn, rings and jewelry and other items should be removed. But as Ravi had already said in the previous slides, that now it's not only the product, but it's the personal protection as well as the person who is along with me or working with me. Nails, no doubt, we need to ensure that the nails has to be cut short. But one point here I would like to add is that how are we ensuring that whether the nails are short? Because if the nails are there, of course the spaces will be there in between the nail and the skin, and it's a very good place for harboring of the germs. So the best thing is that once you press the tip of your finger against your skin, and if you can't feel the flesh of your finger but the nails, then you have to ensure that the nails are to be cut. Clean shave, as I mentioned earlier, that an average person touches their face almost 23 times an hour. And if the viruses are on the hands, there are chances that it can harbor itself within their beards. And every time you are not washing your faces whenever you are washing your hands. So therefore, it can move across to any part of the face and enter through your eyes, nostrils, or mouth. Therefore, it's better to have a clean face and avoid beard as much as possible. Fresh and washed dresses, no reuse. We all are aware of that. It's also important to know that the real risk of this infection comes from person-to-person contact and respiratory droplets. There is some theoretical risk that you could be infected through clothing, but it's very small and can be minimized even further. How? That is, better to discard the clothes, wash, and wear fresh clothes. Rings and jewelry items, rings, with the dirt or with the sweating there as we all are aware that it's a very good condition for microorganisms to multiply. And so the best thing is that in this situation where we need to take extraordinary measures to limit COVID-19 transmission, we should try to think of removing the rings and jewelry while before the washing of the hands, or perhaps limiting their wear altogether right now, and that will represent a very wise forward. I do during while I'm telling all these things, there will be many of the members who are in this group listening to this will feel that how can I remove my wedding ring or how can I remove my engagement ring? The sentiments are attached, no doubt about it. I too have my sentiments, but the best thing I have done is I removed my ring. As of now, the first and foremost thing is to maintain the health of ourselves, our family members, and the people, the team who are working along with us. We will have sufficient time in future for maintaining our sentiments. Over to you, Vishal. Yep. So these are some of the items. These are some of the items that are used in routine, and we have been, anytime and every time. These are the part and parcel of our life when we are coming from home to office or going back. But are these really required? That is the first and foremost question. Or how many of the things we can bring, whether the purses are required. I feel that we can avoid that, because purses and wallets, it has so many nook and corners inside where the way you wash your hands for 20 seconds or sanitize your hands, keeping, trying to ensure that all the surface areas are clean, sanitized. I'm sure that none of any of us will be thinking to have our purses and wallets to be cleaned or washed or sanitized. So the best thing is to avoid that as much as possible. Try to keep as much the required amount of money or cards in your pockets, and better it to keep it at home or not to use it. Even though you keep yourself washed, wearing the clothes, good clothes, clean clothes, sanitizing your hands and every time. But the most dirtiest of the thing, in spite of all these things, is their mobile phone. The studies has demonstrated that there are, it's 10 times more germs on your phone than on a toilet seat. So unless and until if you are having a habit of regularly cleaning, you should listen to this, regularly cleaning your little portable germ box, because you are carrying that much of germs along with on the surfaces, and it has so many crevices in that. There will be millions of microorganisms which are embedded in that. So we have to ensure, we need to change our habit of either we reduce the use of mobile phones. I'm sure it is not possible because it's had become a part and parcel of our life. So we have to ensure that how we can reduce a micro load. Can we use some mild disinfectant, mild soap solutions, mild damp clothes to remove or to sanitize on a frequently. So that habit needs to be inculcated, and this is the best time to improve to implement that habit. Phone covers, better to avoid that. As I said earlier, for the purses and wallets, phone covers, we all try to save our phone by by trying to have to ensure that the screens doesn't have any scratch marks, or if it fell, it should not break. Fine, but at the end of the day, if you are keeping the phone cover, it has a number of microorganisms in that, and I'm sure that it will be difficult for anyone and everyone to ensure to have a cleaning or washing of the phone cover especially. So it's better to avoid that as much as possible. Belts, majority of the belts which are, and there is an obsession, or there's feeling one should be always try to go for a pure leather belt, and leather is one of the most the medium where you can have huge amount of microorganisms which are embedded in the very fine particles and pores of the belts. Not only leather belts, if it is made of any other material, whether it's plastic or resin or any other MOC, the belts are harboring and millions of microorganisms. So can we sanitize or can we wash it? The question is that if you wash a pure leather belt, you need to dry it. You have to ensure that there is no, because leather being a good medium for growth of fungal colonies, it's better, so no one will be washing the belts. But sanitization, how much we can sanitize, how we can ensure that whether the microorganisms within those which are embedded within the pores of the belts are removed, with the particle, the germs which are in the holes are removed. So better to avoid using the belts for a certain period of time, and automatically once you start not using it, of course it will be a part of your routine daily, and it will be habitual also. Spectacles, coming to it, of course, spectacles, I can understand, even I am also wearing a specs, so I can understand I cannot keep away myself from the specs. I have to. So the best thing is that whether we need to come up with some procedures where we can routinely sanitize our spectacles with either with warm water or some soap solution or some mild disinfectants, which will not destroy the overall the efficacy of the efficiency of the lenses. Blazers, we used to wear blazers. There was a time when we always preferred to wear blazer, but now, and as we are once we reach home, we are trying to wash our clothes and then reuse the fresh clothes. Now blazers you can't wash every time; it has to be dry clean and everything. So do we really need to wear a blazer while coming to office from home? That needs to be thought, and better to not to use it. Laptops, carriers and handbags, better to not to use laptop bags, because I know we keep these materials unattended in office for a very long time and then take it home. And I'm sure that none of us will ever think of sanitizing a keypad or a laptop using a disinfectant, because of course rather than sanitizing it, it will destroy the overall system. So better to keep the laptop and the bags in the office, and try to avoid try to take it home, or try to avoid taking the laptops along with you. Over to you, Vishal.
Well, thank you, Ranjit. These are some of the interesting observations. I mean, what I hear is that my phone is like my toilet seat, which I keep carrying along with me, and I bring it close to my face. I probably touch it through my lips, bring it close to my ear. I mean, that's really interesting. So, bringing a toilet seat close to my lips. Ravi, what's your take on the use of mask? Because Ranjit is saying that sometimes very innocent looking objects like our phone, like several other things, they could be a carrier of germs, and in this case, this contagion. So, what's your take on the use of mask in parental facilities? We are hearing many contradicting advices on the same. Some says you wear the mask all the time. Some says you need to be, not wear the mask at all. So one is on mask, and second is the usage of the shoes, the street shoes, the plant shoes, the clean area shoes. If you can give us some advice on that, Ravi.
Okay, so I think that bit about the masks and the controversy is very much relevant. When we started this COVID journey, there was a shortage of masks all over the world. So most authorities said you don't need a mask, only healthcare workers need masks in order to conserve the masks. So, we started with a bit of mixed messaging that with WHO trying to say, oh, an ordinary guy doesn't know how to wear a mask. And, he could make mistakes and he could contaminate. So this mixed messaging, which was carried through media, social media, has created a lot of doubt in many people's mind. First thing is, do you need, I will again go one step back to what Ranjit said, clean shaven. So I guess the first requirement is that the mask fits snugly. So you can imagine the challenge when you are trying to manage a beard with a mask. I mean, it's not going to be one doesn't expect a hermetic seal, but at least a snug fit is a minimum requirement. So that becomes a significant point. Uh, do you need to wear a mask all the time? Well, if you consider your house as a reasonable safe haven, you don't need to wear a mask within your house. But the moment you step out, it's like wearing your clothes, and you want to be. One of the item of clothing is now going to be the mask. This is the new normal, and even if the lockdown is over, the virus is not going to be governed by lockdown. So it's going to be a long time before we stop wearing masks in the streets. Um, some foreign countries have permitted that if you are climbing a hill all by yourself, maybe you don't need a mask. But the trouble is, in a country like India, giving a mixed messaging is a challenge. So trying to say, yes, please wear it all the time is the better approach. Okay. And the fine nuancing of when to wear, when not to wear, I think that becomes a very difficult set of instruction for people to understand. So some steps are already outlined. You must have read what is in front of you, that you need to really sanitize your hands before you wear your mask. Otherwise, you'll end up transferring stuff from, the hand to the mask. For example, you're rushing out of your house for work. You have the mask in your pocket. You quickly punch a couple of lift buttons, get into the lift, in your hurry, you overbalance, you touch the lift side, and then you say, oh, my mask is not there, and you pick the mask out of your pocket. Not a very good situation. You need to have your hands very clean before you do that. Make sure that, since I'm speaking to pharma people, I'm not really going to go into saying that the mask should cover the nose and all that. You guys know it. Okay, then discard the mask as soon as you finish up, and then some cities have some new norms. For example, I think Pune now requires you to put it into a cover and mark it with a red dot, so that the rag pickers or healthcare workers who are handling do not accidentally use it, so or touch it that way. That's one thing. Then the important part, of course, to remove it from behind, that don't touch the front side. So you need to put your hands around it and take it out, so that you don't touch the dirty part of the mask is obviously the front side, because whatever, if someone has sneezed in your vicinity, it's going to be settled on the front of the mask. So you should always touch the back of the mask. And in any case, as an extra precaution, wash your hands when you take off the mask. Could you go to the next slide? Street shoes. Again, in India, we are fortunate because we already have the habit of designating your street shoe as a dirty object. I mean, we all know that our streets are pretty dirty. We have been trained from childhood to generally keep your shoe in the corner of a house. A few of us have been a little more adventurous walking into the house with it, but now that needs to stop. We need to make sure that the shoes stay right at the entrance, preferably outside the house, and not be part of your. And you have to train your family members about a virtual changeover, a step over bench. That it's quite difficult for a non-pharma person like your family member, maybe your spouse, your daughter, or your father, and trying to tell him that you cannot step out with your bathroom chappals or house slippers and then step back again. You cannot step into the area where the shoes have been worn, and you need to keep the shoe here, and then you need to step over. You need to explain this to all people in your family so that they follow this very carefully, because the shoe is one part which is touching the road, and the road is sure to have contaminants in many places. Of course, the sun will take care of considerable part of it, at least when the summer is there. But all the shade and all the common areas and staircases, there is always a potential that you will pick up stuff on the bottom of your shoe. So the shoe, like the hand, is again a very vulnerable spot. And why is it vulnerable? Because you will transfer the material onto your foot, and you may transfer it onto your bed if you're not careful, and then it's like a slow a slide into trouble. Okay, Vishal, over to you.
Well, thank you, Ravi. By the way, we have a few videos, and at the end of this session, which was shot by various pharma professionals in their facility. And these videos, one of it is about how to wear mask and how to remove the mask. So I think that will come up. Now, before we move forward, Rajat, your comments on what is Ravi has just stated and adding up to it. He's talking about mask, he's talking about shoes, he's talking about how to take care of it, so and so forth. But what about handling the clean room garments and inner garments? Are there any changes which are supposed to be done, or can we continue with the current practices of handling them as what we are doing now?
Vishal, I would say that the situation has changed. It has never been the same what it used to be in the past. Before January 2019, the situation was something else, and now the situation is something else. As Mr. Ravi had shared in his previous slides, there are changes in the wearing of mask, wearing of and washing of hands and everything. So here, one of the most important point what I would like to add here is that regarding the procedures or the change in procedures and processes that has happened, at least in handling of garments. No, now I'm sure that majority of the team who was sitting in this particular discussion group is from all pharma, and all are working in majority of them must be working in injectable plant. So what I'm going to do is I'm just breaking this slide into two parts, as far as the garments are concerned. So one is the factory garments, and second is the clean area garments. As in the very first slide we had seen, there was in the slide it was also there, the factory as well as the clean room garments. So what happened is, and of course it's across the Indian pharma industry, that majority of the cases the factory garments are sent outside for washing, and the clean room garments for the aseptic area washed within the premises with the validated load. Coming back to the factory garments, so what has happened now is post usage of the garment, which is already once a person is using the garment and then it is been dumped into the garment in the dustbin or the bag, it is then collected and then it is taken outside for washing into in a different facility. So how it is being collected? Well, the person who is handling the garment now need to ensure that he is wearing a gloves, he is wearing the mask, and handling of the garment should be in a very in a cautious manner, because you never know which garment was worn by whom, what was the overall condition, what was the overall condition of the health. We are not aware of that. So there, the first step that has happened here is gloves and the mask for the handling of the soiled garments. That's the primary garments. Once it is it is collected, it is then taken into it has been sent to an outside facility, whether that's a different vendor, and it has been washed there. So we need to ensure one thing there, that we should go to that particular vendor facility. We need to ensure that how our factory garments are handled at the vendors. And now this has become a major point here, because with this COVID-19 situation, whether the vendor staff are following the same way as we are doing it. Is the vendors, the staff is following, they are also wearing the gloves, they are also wearing the nose mask. Is the staff undergoing a daily temperature monitoring? Do they have a contact recording form? And how about, once of course, the garments are washed, we in order to qualify the vendor, we go and see the process and everything. Of course, the garments, the clean room, the factory gowns, garments are washed. They must be also, they are also have a validated procedure. They are also using soap, or detergents to wash. So automatically, the cleaning procedure, the washing procedure will remove all the dirt and any viruses or any contaminant that is present in the ground. It will be removed. But once it is been washed, how it is been transferred to a drying machine? Is it, if they do have a drying machine, if it is yes, how it has been transferred? Are they wearing a gloves? Because once, if the hands are not if the hands are not gloved, or if the person is handling with a naked hand, there are chances that the washed garments again can get contaminated. So there the gloves has to be in place, mask has to be in place, and sorry. So coming and then how it has been racked, how it has been taken back to the facility. So that is where the additional activities that has come into picture. Second is the aseptic garments. So everyone is aware, once the garments, once the person comes out of the exit airlock, it is just either it is thrown into the bin, or in some other facilities there they must be using the dedicated, the same bags which was used previously. So once it is, again, who is handling that particular garment, again the person need to ensure that the gloved hands and mask has to be worn properly, and the person's contaminant should not touch the gown, or the gown's contaminant, or the germs should not be passing on to the person who is handling. Every site has a validated procedure for washing and drying, so there is not a concern. But before the washing, it has to be gloved hand. Once the drying, if the washing machine has both the washing and drying setup, it's okay. But if there's a separate drying machine, so how it is handled there, how it has been transferred into the drying machine, how we are handling it post drying, how it has been, we do, again, in injectable facility, the checking of gowns is very important to see whether there are any threads which are coming out or some tone. So every site must be having that procedure for checking of that. So how it has been checked. So all these things which, and we need to ensure that we should not be contaminating the material which is already cleaned or washed. So here some additional changes has happened, Vishal, which has, which has made to include these many points into it. Over to Vishal.
Well, thank you, Ranjit. That's so insightful. And there are a few questions which I could see about gowns, about the mask, and about washing and handling things. And we will talk about it. I can assure everybody. Some of you are saying, please unmute. See, there is a problem when we unmute. There is a lot of echo which starts happening. So that's the challenge. So please start typing down your questions, and we will definitely take all those questions. So moving on, Ravi, what is your suggestions with respect to the changes in entry and exit procedures which has happened due to pandemic? We have spoken about gowns, we have spoken about washing, we have spoken about masks, we have spoken about how to handle our shoes, street shoes, plant shoes, and we have spoken about what material we need to bring in and what we should avoid with respect to jewelries and so on and so forth. But when it comes to actual entry and exit, what are the changes you foresee? Ravi?
Yes, thank you, Vishal. Could you just go to the next slide? Yeah. So all pharma professionals are familiar with the concept of a room occupancy. Okay, all of us have defined occupancy for different rooms. In fact, we are supposed to even track whether the occupancy is being proportional or worst case in our media fields. So a number of people in a room is not an alien concept to us. But what has changed now is that we may have to relook at the room load depending on the room size. Yeah, it may not be that if you have a norm of 2 people in a change room, unless your change room is really big enough for that, you may have to think about revising that norm, that maybe only 1 person. But if it's a large enough change room and you're able to maintain your 8 to 10 feet, 6 feet is the government norm, but I think 8 to 10 feet. And then, you may be able to put more people. This is an assessment you people need to conduct yourself in each of the change rooms when you enter. Then the important thing is goggles sanitization, which has been talked about here, it's better to get autoclavable goggles, and because the eye is one of the routes of transmission. So sanitization, yes, up to a certain point it is manageable, but we are now introducing we have been always autoclaving, and I think that is something everyone needs to move towards autoclavable goggles and things like this. And of course, the concept of gowning gloves is also something which most companies already have. So the gowns are to be touched only with the gloves. So that's about entry. If you go into the clean room and you are in the clean room, you may want to relook at processes. There was a discussion whether you are completely safe in your, grade B dresses, and the consensus was, if the grade B dress was perfect, then you would not have a single count in your grade B area, because you would have perfectly managed to control the person radiating microorganisms. So just as we all know that there are going to be counts in the clean room, um, the COVID also can escape in the same way, and therefore you need to be careful in the clean room. The clean room is not totally going to be free of COVID if there is an infected person. So if, for example, there is a requirement of 2 people, lifting something, one needs to relook at how that is being done, etc. Now we come to the exit procedure. Again, depending on the size of the the room, you have to be careful about how you exit the area. All of us who has worked in a clean room, every time you leave the clean room, it's a sense of freedom that we have. We just rip off the mask and rip off the hood and take a very deep breath of air, and then you feel, finally I've come out. That strap of the goggle which is digging into your skin, all those things you are rushing to get rid of. But now you have to be very careful. You will see videos towards the end how you need to remove the gloves and how you need to ensure that the inner surface of the glove remains on the outer surface in the ball you create. That's something which will be clear when you see the uh, the videos. And then of course try as far as possible to flip the gown and put it into the bin. The gown is also a potential source of contamination if the area had got contaminated. The rest of the steps are in front of you, so I will not waste time in it and give it back to Vishal.